Waiting times have been seen as a success story at the NHS, but as it's revealed some people have waited weeks, maybe months longer than thought, there's real doubt about the reliability of waiting time figures. The National Audit Office reviewed the waiting times of 650 patients at 7 hospital trusts, and it found more than half were wrong or unreliable. 202 didn't have enough documentation, and 167 had at least one mistake, meaning they couldn't be trusted. So a question for the man in charge. Can we trust the figures?
Well, I think we can be broadly confident in the figures, but...
Broadly confident?
Well, as I've explained, today's report says that there are some inconsistencies. We'll address those. It does not say that there is deliberate misreporting of figures, and it does confirm that changes this government have introduced has led to a reduction in the numbers for people who are waiting a long time for their operation.
For the longer waits, maybe, but this report also says what it calls the typical waiting time is steadily increasing. Labour, who in power ordered the first waiting time targets, says the government is losing its grip.
So how can people have trust in what the government is saying? You know, people are waiting longer for treatment than the government is admitting, and that's not fair to them. So I'm saying there needs to be an urgent review by the Department of Health into these, the collection of these statistics to ensure that the public can have trust in them.
The target is that 90% of hospital patients should be treated within 18 weeks of diagnosis, and that target is broadly being met. But the figures still show a rise in the number of patients whose treatment is taking longer.
On the whole, we're just terribly grateful for everything we get in relation to the NHS and don't feel empowered to do something about it. So here's a right. You have the right to be treated within 18 weeks. Go and insist on having it.
The government's record on the NHS will be a huge part of the election campaign, and waiting times will be a big part of that.